According to the Centers for Disease Control and Prevention, about 5 million Americans over the age of 65 had dementia in 2014, and the number is growing. CDC. According to the CDC, over 14 million older persons will get dementia by 2060. Dementia has also lately become one of the major causes of death in the United States, with the number of dementia-related deaths more than doubling since 2000. However, dementia is not a typical aspect of aging, despite the rise in cases and fatalities. According to research, there are various things you can do earlier in life to either enhance or decrease your risk of having dementia. Tea drinkers are likely already on their way to avoiding dementia, according to a new study that found that drinking this beverage on a daily basis can reduce your risk of dementia. Researchers from China's Tianjin Medical University investigated the effect of tea consumption on the risk of dementia, published their findings in the PLOS Medicine Journal on November 16. The study looked at over 365,000 people from the United Kingdom Biobank who entered the cohort between 2006 and 2010, when they were between the ages of 50 and 74. Participants who drank 3 to 5 cups of tea each day had a 30% lower risk of acquiring dementia, according to the study. The study found that drinking 2 to 3 cups of coffee each day reduced the risk by 28%. The researchers did not go into the specific science behind why tea can reduce your risk of dementia, but they did provide several hypotheses. Tea, according to these experts, includes various compounds that have the ability to influence aspects that may lead to some type of cognitive impairment as people get older. Caffeine, catechin polyphenols, and flavonoids found in tea have been shown to have neuroprotective properties such as antioxidative stress, anti-inflammation, inhibition of amyloid beta aggregation, and anti-apoptosis, according to the study. The researchers also looked into the effect of coffee on the risk of dementia. The study found that drinking 2 to 3 cups of coffee each day reduced the risk of dementia by 20%. When compared to decaffeinated coffee, the researchers discovered that instant coffee and ground coffee were both linked to a lower incidence of dementia, Alzheimer's disease, and vascular dementia. According to the study, ground coffee was 26% more likely than decaffeinated coffee to lessen dementia risk, while instant coffee was 15% more probable. Ground coffee reduced the incidence of Alzheimer's disease and vascular dementia by 33% and 26%, respectively. Alzheimer's and vascular dementia risk were lowered by 19% and 16%, respectively, when instant coffee was consumed. This study looked at the risk of stroke associated with these two beverages. The researchers discovered that those who drank 2 to 3 cups of coffee per day had a 12% lower stroke risk, while those who drank at least 2 to 3 cups of tea per day had a 16% lower stroke risk. And of all the beverages, coffee and tea may be the most beneficial. Indeed, the researchers found that coffee and tea combined seemed to correlate with a lower risk of stroke and dementia when compared to coffee or tea separately. People who consumed a combination of 4 to 6 cups of coffee and tea had the lowest risk of dementia and stroke, according to the study. 2 to 3 cups of tea per day, along with 2 to 3 cups of tea per day, reduced the risk of stroke and dementia by 32% and 28%, respectively.